But yes, I think they can. Hang on. You can follow the process a lot. No, it should be okay. We inspire this as well. Here, Liam. Yep. So you're both home. I don't know if you want to get both. I go on this side. Yeah, you can. Yeah, you're good there. So we can transition. Yeah, there you go. Should be okay. Are we on? You want to get everybody? Just get
No, so maybe I can
yeah,
move
you
this
should
off to
be
this.
good there. Maybe I'm a bit to the side.
Right.
Oh yeah, the monitor. That's a good monitor. Cool. We can get started.
Yeah.
Okay, everyone, we're gonna get started. So you can have a seat. Thank you all for coming. Okay, thank you. Also, nice that you listen so well. This is surprising. So I'm Melissa. I'm an OT clinical resource therapist with the BCH Long-Term Care and Assisted Living Professional Practice Team.
My name is Liam. I'm a rehab assistant with BCH as well for the assisted living team.
I got you.
So we want to first start with the land acknowledgement. So we would like to honor that we are gathered here on the traditional and beautiful land of the Coast Salish people. That includes the Musqueam, Squamish, and Tsleil-Waututh. VCH is on much bigger land as well. So Vancouver Coastal Health is committed to delivering exceptional care to 1.2 million people, including the First Nations, Inuit, in the region. Within the Healthsec, Lilwat, Musqueam, Ikwakwa, Newhall, Samaquam, Shisha, Skatine, Squamish, Playaman, Tsleil-Waututh, Owikino, and Hatsal. I'm very grateful to be here with all of you today. So today, for this first presentation, we're talking about working with your RAs and really using them to promote independence within the long-term care homes. So we're going to focus on promoting independence, who is within our long-term care population, how do we incorporate the RA, choosing the right people to work with the RA, setting your goals, and we'll end with a couple of success stories. So to begin with, when it comes to, thank you, promoting independence, independence includes the ability to complete tasks, but also the ability to really choose what tasks we want to complete. And so as we age, the ability to do things independently, both cognitively and physically, becomes more challenging. So within our care homes, you've probably seen the Resident Bill of Rights. And within the Bill of Rights, there are several key points that highlight the need to promote that independence. So starting with the commitment to care. An adult person in care has the right to a care plan developed specifically for him or her and on the basis of his or her unique abilities, physical, social, and emotional needs, and cultural and spiritual preferences. Then we have the right to health, safety, and dignity. So an adult person in care has the right to protection and promotion of his or her health, safety, and dignity, including a right to be treated in a manner and live in an environment that promotes his or her health, safety, and dignity. And finally, the rights to participation and freedom of expression. So an adult person in care has the right to participate in his or her own care and to freely express his or her views, including a right to participation in the development and implementation of his or her care plan. So these are set out by the Government of Canada, saying that everybody within our care home has the right to be part of their own care plan, to be independent. It doesn't always happen that way. So how can we really honor that Bill of Rights and help promote independence within the care homes? One thing we can do is we can use the PIECES approach. So PIECES is a holistic team approach to supporting older persons living with complex conditions. Most often with PIECES, we bring that in when somebody has some behavioral expressions and there's concerns. But we can also use it to prevent some of those things from happening. So PIECES is really good at highlighting what are the individual needs, what are their strengths, and really focusing on that individual and promoting what are their underutilized capabilities. So PIECES is broken down into physical, and so with physical, it's looking at what are their diagnoses, what medications are they on. But there your focus is really on quality of life. With intellectual, you're looking at the cognitive abilities. And quite often we'll look at what are the cognitive deficits, what are the losses, but instead we want to look at what areas are still intact and how can we support that. For emotional, we have your emotional health, your mood, substance use, trauma history, but we also really want to look at what coping strategies does that person already have in place and how can we use that. Capabilities is really where our ADLs come in and what is the person capable of doing. Quite often in our care homes, what happens is if somebody needs support with part of their ADLs, we just end up doing the whole thing for them. So what we want to do is really look at what are they capable of and how can I support them to do what they can do. Environment is the physical and social environment, and how do we set up that environment so that they can engage meaningfully. And the last is the S, and that's social, and so that's where we're wanting to really look at the person's life story and figure out what is meaningful to them and how do I incorporate that. So we can use this, really target what does that individual need to help promote that independence. So now we want to look at who are the people that are within our care homes. Many of them are frail. And so frailty is a multi-system reduction in capacity of physiological systems nearing or passing clinical failure. One of the big things about frailty that we don't always consider is that it is actually reversible. And so according to the World Health Organization, they really want us to target frailty and promote that independence and healthy living, which is going to counter frailty. So we need to promote the independence to really deal with this. And within the VCH region, if we look at our RI data, 30% of the care homes, 30% of the people living in the care homes have had a decline in their ADL self-performance. So 30% of the people within the homes are already noticing, I'm declining in my ADL self-performance, and so that means there's people that we need to support. So most of us here, I would say, are either OT, PT, or RA. So these are what our roles are within the long-term care. And really, the main focus is supporting the daily activities. And the RA is going to really help to implement the strategies that the OT and the PT are suggesting. A common thing, however, is that we don't support everybody. So research shows that there's a couple of groups that we don't support that well. The one being those with cognitive impairments. And research shows that if we do support those people with cognitive impairment, that they will have improvement in their physical functioning, and it will slow that decline in ADLs. So that's an area that we need to improve. Another one is those that have higher depression ratings. We tend to not support them as much. And again, research indicates that if we do, that will improve their engagement and their mood. So there's people that we need to support a bit more. And where do we target our interventions? You can look at the ADL functional continuum. So generally, as things decline, they will decline across this hierarchy. So the more complex the task, the more skill is involved, and the more basic the task, the more it's going to be related to routine. So when we start to notice decline in one area, that's where we're going to put our support. We're going to support where the decline is, but also just right below to prevent that further decline. We really want to make sure that we are bringing in our RAs to support, because quite frankly, when we look at we're not supporting everybody that we need to, part of that is also we don't have the time or the capacity to support everybody. So we need to make sure that we engage the RA so that we can reach a broader group of people within our homes. And when we do bring in the RA, we get improved quality of life. Somebody's now able to do their ADLs. They're more independent. They're getting more meaning from being able to do the things that they want to do. It reduces the risk of decline in the ADL. So when they're more engaged, there's less likely to have that decline. And it can reduce the amount of time required by care staff. It doesn't always start off that way, so initially it does take a little bit more work. But if you think of somebody needing a setup assist versus a one-person assist, that will make a difference. The other thing, when we talk about the cognitive impairment, when we're bringing in the RAs to work with people that have a cognitive impairment, we need to make sure that that is happening regularly, because you need to have that routine built in to really create the new learning. But the RA's time is also very valuable. So we want to make sure that we're choosing the right people to work with our RAs. So we want to ask, can the person in care do what they want independently? And if they can, that's great. We can still get the RA to work with them, but they're going to work with them probably more in a group setting. So we're not going to have that targeted one-on-one intervention. We're going to try and maintain their strength and range of motion. But when we start to notice that there is a decline, that's where we're going to have the more targeted RA intervention. And we want to really figure out why they can't do what they want. And that's going to help us figure out what we want the RA to do if we know what's causing the impairment. We want to make sure that the person actually wants to work with the RA, that it actually is a goal for the person. Because yes, they might not be able to feed themselves independently, but maybe they don't mind being fed. So there's not as much of a need to support somebody if it's not upsetting to them. We want to use the RA somewhere else where they're supporting someone where that is their goal to improve. You can also, again, going back to the ride, you can use that to help choose who would be an appropriate person. So we talked about that decline in their ADL self-performance, but you can also look at the caps that are triggered. So the caps for falls and urinary continence are two of the ones that are good triggers to indicate when rehab support would be needed. We want to make sure that we have measurable goals. So we want to look at what is the ADL the person in care is currently not able to do on their own. So in this case, we're going to say that the person is not able to dress their lower body. So what is causing the difficulty with them completing their ADL? Again, in this scenario, I'm going to say that they have decreased balance. And what is the effect on the person in care? So in this situation, the person is needing support with their ADLs, and they're feeling frustrated that they're losing their independence. So because it does ultimately have an impact on the person, that's something that we want to support. So the RA might be brought in to work with, the physio might be suggesting some exercises to help build their strength, working on balance. The OT might have some adaptive aids, and then we're going to bring in the RA to say, can you work with the person to teach them how to use this? We might also modify the task a little bit so that they're not standing as much when they're completing the task. And again, if they have a cognitive impairment, we want to make sure that we're doing this regularly to build that routine and learning. And then you want to have your care plan. And you want your care plan to be specific so that everybody knows what they're responsible for. You know very clearly who is doing what and when. I'm going to pass it over to Liam.
Okay, awesome. Yes, my name is Liam. I'm a rehab assistant at assisted living program for PCH. Before doing assisted living, I was working at a few hospitals in Ontario for the past few years in acute medicine. I was float staff for a few months and worked on ICU as well. So just in my time in the past few years as an RA, just a few examples of ADLs I was completing, anything from dressing of the upper body, same shirts, whether it just be a regular t-shirt or one with a zipper, or doing buttons as well. So a lot of fine motor work can be done with that too. Personal hygiene as well, brushing your teeth, washing your face, combing your hair. Those are all big things that we work with some of our patients on. And Melissa already mentioned the lower extremity dressing, as well as donning and doffing shoes, and using different adaptive equipments, as well as doing transfers, whether it be to a commode or a toilet, and doing personal care as well. So just trying to promote independence for the client as much as we can.
And then I just want to end with a couple of success stories. So the first one was a woman who previously was living at home independently. She would golf regularly. She did all of her own grocery shopping, driving, and then she had a stroke. She went to acute care and was directly admitted into long-term care. And that wasn't distressing to her. She was okay with that. What she was not okay with was getting assistance to dress. And she wanted to get herself dressed, and she wanted to get herself dressed in her own clothes. And specifically, her jeans with the fly and the button. So because of her hand contracture, that was a real challenge. So it was a full team approach, and we had to have the care staff do just a setup assistance, go help somebody else, and then come back and help her with the fly when she wasn't quite there yet. We had the RA working with her for some fine motor tasks, working on her grasp and things like that. So over time, she eventually was able to do up her pants. I came into work one day, she was at the end of the hall, and she came wheeling across just so excited because she put her pants on herself. So it might not seem like a big thing, but to her, it was huge. And if I didn't have the RA to work with to do all of that extra time, I wouldn't have had the time to get her to that point. Likewise, we have another lady who came in. And she had multiple times of going to the hospital, going home, and eventually she was at home and she had fallen, and it had been a long time before anybody had found her. And so ultimately, the team in acute care felt that she needed to go to long-term care. She was never happy there, did not want to be there. It really didn't matter what happened. She just didn't want to be there. So she also had a visual impairment and hearing impairment. So she had a harder time trusting everybody in this new environment. Her daughter came and she had a change in her job that she was actually going to be home more, and said there's a potential to put a suite in. So we were going to change things so that her home would now be in a more supportive environment. So the RA worked with her for doing strength, and she was part of a walking program. They did a lot of the transfer training that Liam was talking about. And not just transfer trainings. At home, she was going to have a handy pool. So we got a handy pool put in her room in long-term care so that she was practicing with what she was going to use at home. Then we had all of the equipment and organized everything, and eventually she did make it home. And again, none of that would have happened without the RA. So we need to make sure that we are using our RAs to really maximize the amount of people that we can serve. So, here's all the references. Any questions? Okay, thank you.
So we're just going to take like 2 minutes to transfer over into the next session, and then we'll get started. Thank you. Did you turn it on? Okay, thank you. All right, enough transition time. Thank you, everybody. It's so good to see, like, far away Richmond people are here. So it's really great to see Hamilton and Fraser coming. We're very excited. Thank you. My name is Jill, and just like Melissa, I'm an occupational therapist, clinical resource therapist with the VCH long-term care team, and I missed Melissa's intro, but I just wanted to give a huge shout out to our team, all of these folks here, and Rachel over there, and Joseph too. Everyone's come out to put this on, and with the people who are on YouTube as well right now. So thanks to our team for supporting me and Melissa for all of this. So today I'm gonna talk about slings. It sounds kind of boring and dry, but it's kind of like the flip side to what Melissa and Liam were talking about. So just like when we are helping people to perform their ADLs in a long-term care setting, some people, like Melissa and Liam said, might be appropriate for promoting their independence, promoting their recovery and their rehab goals, and utilizing a rehab assistant and goal setting to be able to achieve those goals. Then you kind of have the other side where sometimes the goals are different, and it's not about promoting independence and promoting building strength and function, but rather accommodating to whatever the person's needs might be. So this is where choosing the right sling can be really helpful for ensuring safety, ensuring dignity, ensuring that the person you are caring for and the people who are doing the care can remain safe and nobody gets injured, right? So today we're going to talk about slings. I've got Kim. He is a peer care aide with our team, and he's going to help me now and also afterwards when I'm finished talking to demonstrate some really cool techniques using the slings that you probably already have in your care home to promote safer and innovative and creative ways to perform ADL care tasks in bed for people. And then I wanted to say thanks to Brian and Lana for coming and bringing the bed and the lift and the slings and the massive banner for helping us out with that. And then also to Bobby in the back for bringing out the commodes, because we're going to be using those later on dry. Okay. All right, Melissa did the land honoring, so we will miss that. And today, though, we are going to review some VCH mobility assessment tools. These are the mobility assessment tools that are used in VCH long-term care homes and in other VCH settings. If you are from a contracted care home and you would like these tools to use in your own home, you can just ask me or Melissa and we'll send it out to you. And you're more than welcome to use these tools. We're also then going to talk about how to choose an appropriate sling and what criteria and factors you might want to think about to choose a sling. Compare different styles of slings and when you might want to use one over another. Considerations for safe and dignified toileting and showering in a long-term care setting, and when you need to replace a sling. So before we do any transfer or before we do any type of care for a person, you always want to make sure that we do a point of care risk assessment. And that is to make sure in that moment, you and the environment and the person that you are providing care for and the task that you are doing are all ready and set up to go so that you can have a safe and successful interaction and provide safe and successful care. So with the point of care risk assessment, you might have seen this before. You can use the STEP acronym just to go through your head to make sure that everybody is in the right frame of mind and you've got everything you need to go to do it safely. So you want to think about yourself. So do I have the skills to be able to do this task? Do I have the knowledge? Have I done this before? Do I have any questions that I need to ask somebody first? And also, am I in the right frame of mind to do the task? So did I just rush in through a huge traffic jam on the Lion Gate Bridge to try to get to the hospital? And now I'm all flustered and I have to quickly transfer somebody into a tilt wheelchair? Or should I just take a breather, take a minute, the person's going to be fine for another 2 minutes until I come in and I'm in the right frame of mind to perform the task. Then you want to think about the task itself. So do you know how your person does the task normally? Have you read the care plan? Have there been any changes in the care plan and how we do that task? And then we want to think about the environment. So is the environment safe to perform that task? Do you have all the equipment that you need in order to do it safely? And then lastly, you want to think about the person that you are providing care for. So are they in the right frame of mind? Is this a good time for them to have this task done? Has something changed about them that you need to be aware of? And then if you think that it's the point of care risk assessment is a green light says go, you can proceed. Then if you are doing a manual transfer, then you might want to consider, well, you need to consider the safe pre-transfer checklist. So in order to manually transfer somebody, like with a one assist, for example, you need to make sure that they're able to follow simple directions consistently. And then you would do your classic 4 steps, ask them to bridge, ask them to lean forward, clear the surface, and then step using a gait aid or not. But this is all review for all of you, I think. So this is the VCH mobility decision support tool. And this is the one where if you would like to have a copy of this for yourself and in your home, then you can ask us and we'll send you a copy of this. But this is a really great tool. The questions are really small here, but what it does is it guides you through considering your person's physical and cognitive abilities to help you decide how we should be supporting them with their bed mobility and how we should be supporting them with their transfers. So this tool will, at the very end, you might get all the way down to this far and it says the person's able to walk independently with or without a gait aid. Okay? Or it might say, oh, for bed mobility, you need to use a repositioning sling. Or it might say for transfers, yes, they do require a lift for transfers, but it might be a sit to stand. Or it might say you might need to use a full lift to support transfers. This mobility tool needs to be done anytime a new person comes into your care home. If there's ever been a change in that person's status, for example, they've had a fall, or if they have changed location. So if they recently came back to your care home from acute care, or they transferred from one care home to a new care home, the new care home still needs to reassess their mobility because something might be different between those to the change. Maybe the person changed, or the environment has changed, or the equipment you have available from one care home to the next is different. So this really needs to be done often, and it can be done by OT, PT, or nursing. So if you've done the decision support tool and it says, yeah, you should be using a lift for your person. You're like, okay, we know we need to use a lift, but with the lift, there's all these different slings that we can use. What kind of sling should we use? So this light assessment is from the HME Sling Resource Guide that you can find on the website. And it goes through some different questions to help you think about different factors that might play a role in choosing the right sling. You know how when you are, for the OTs and PTs out there, when you are determining product parameters for your seating or for your surface selection that you might want to be using? This is the same idea. This helps to guide you through product parameters for all the different slings based on the person, what you're trying to do for them. Sorry, is that me? No, maybe. Based on what you're trying to do with them. So you want to think about the loads, the person. How much do they weigh? Do they have core strength? How much can they help with the transfer? And can they follow directions consistently? And then the individual is you, the caregiver. So are you able to manage the load safely? Do you require assistance, like a 2-person transfer? And does the caregiver have the skills to be able to complete that transfer? Then again, you want to think about the task. What are you trying to do? Does it require awkward positioning? And does that task follow best practice? And then lastly, the environment. So is there enough space to do it? Do you have the right equipment, etc.? So when it comes to choosing different sling sizes, there's like, how many manufacturers of slings do you have here? At least three. So they're all going to have different ranges of sizes, okay? And so if you're trying to figure out what size to choose for your person, you can go into the you can speak to your rep, so Bobby at XM or HME here, or you can go onto the manufacturer's website to see what the size ranges are. It's like when you're buying online clothes and you don't know what size you are either. Same idea with the slings, okay? Now every manufacturer is going to have a different sizing chart and a different method of measuring the right size. So make sure you follow whatever the sizing chart is sort of stuff falling from the sky. Okay. Yeah. Okay. Now, if you're not sure what size to choose for your person, if they are in between sizes, the general rule of thumb is to size down. Usually that is the safer way to go if they're in between sizes, because if you size up, it might be really big and it could result in unsafe transfer, risk of pressure, friction, all those types of things, okay? Lastly, if a person weighs 130 pounds, it doesn't mean that any size small for them. It's often worthwhile to use a few different slings that fit within that weight range for your person, because they're all going to have slightly different features, slightly different sizes that might help that person to position them in the way that you want them to based on whatever you're trying to position them in and how their body shape is. Okay. So when you're sizing a universal sling, there are 3 landmarks that you want to follow. So first of all, the yellow line down the middle of the universal sling should be centered along the spine. Which one is our? Can you hold it up? The black line? Okay. All right, there's no line. But you all know. All right. Also, the shoulders should wrap around the shoulders, okay, and should get to about mid-collarbone. And then the coccyx, it needs to sit right at the top of the coccyx here, okay? We don't want your person sitting on that universal sling, okay? They're not meant to be sat on at the coccyx area. It should be above. Thank you. You can put that down. Thank you. So Brian showed universal slings. Obviously, the most common type of sling you're probably going to see. These are meant for transferring a person from a seated or lying position to a seated or lying position. These slings can be used for toileting with or without clothing as well. Now, with all slings, you want to consider the fabric type. I'm going to talk about that in a little bit. But also with all slings, you want to consider medical indications. So if a person has like an unstable fracture or they've got hip precaution, something like that, obviously don't use a sling and get them up the lift if that's be contraindicated, okay? Universal slings are not meant for people with above knee amputations because there's simply not enough support through the thigh there to be able to support them safely, okay? And it may be appropriate to use on somebody with a below knee amputation, but that really needs to be assessed safely by OT or PT if it's possible. Hammock slings can be used also if you're going from lying to sitting or sitting to lying, okay? And these, the way the straps support the back of the thigh here, just help to support the thigh a little bit better so that the legs are less abducted. If you look here between a hammock sling, this guy's legs, and this guy's legs, here there's a lot of abduction happening, right? So if your person can't tolerate this and they need more support, then a hammock sling might be a better choice to use. Okay? The other thing too is they provide, generally they come with head support as well, and these are much more supportive in terms of for people who have maybe a kyphosis or lots of contractures and the sling needs to mold around their body a little bit more. Again, depending if we are talking about amputations, these may or may not be appropriate for people with above or below knee amputations. You'll need to assess it on that person. Anyone have hammock slings much in your care homes? You do, right? Yeah. Okay. Awesome. Okay, so comfort recline sling or deluxe recline slings. Okay. Again, they're meant to be transferred for people from to and from seated or lying positions to seated or lying positions. These are really good for people who have an amputation, who are super frail, who have contracture or kyphosis. Okay. Now, you are all more than welcome to get up into these slings and try them out afterwards. We're done because Ryan and Lana will be here to help you all out with this. But you'll notice that with these comfort recline slings, they are really awesome for people who require an open hip angle. So if a person's wheelchair is in a reclined position or have an open hip angle, then you might want to use this sling to get them in that proper position when they're up in the sling before they sit down. Okay? They are designed to stay underneath them when they're sitting. So you'll see they're always made in like a nice black piece of fabric because it's really hard to get them out from them when they are sitting. And of course, if you look at the shape of the sling, you'll see they're not meant for toilet. Okay, there's no way to do that. Okay, next is hygiene slings. So Brian and Lana have brought a couple different hygiene slings here. Now, in long-term care, we all love our good old hygiene slings, right? So there's a few different versions, but both of them you'll see very little trunk support, right? And a little bit of leg support. But what you'll notice with all hygiene slings is that, of course, there's a big opening in the peri area so that people can get up to a commode, have peri care done. Hygiene slings need to be used for a person who's starting in a seated position and are finishing in a seated position. We should not be applying hygiene slings for a person who's lying down and then trying to sit them up with the lift in order to get them up to the commode, okay? So hygiene slings are awesome, but there are some criteria in order for somebody to qualify to safely use one. Thanks, guys. You can put them down if you want to. So a person needs to meet all of this criteria in order to be safely allowed to use a hygiene sling. So they have to have good head and trunk control. They need to have significant hip and trunk extensor strengths to be able to resist the collapse of the lower body. They need to be able to support their own weight through their shoulders, and they need to be consistently reliable and cooperative to the care and predictable. So when do you not use a hygiene sling? If they do not meet, they have to meet all of this criteria. And if they don't, then we should not be using a hygiene sling on these people, okay? They're not meant for people who have leg amputations, and of course, not for people who have other medical contraindications. And these slings are not meant to be left underneath people, okay? So they must be removed. I'm gonna go a little bit more on hygiene slings. So we still love, people love hygiene because guess what? There's like very little fabric, so they're really easy to get under people and really easy to take out from under people, right? But often what happens in many different healthcare settings is that hygiene slings are overused, and they're overused in a way that it's no longer safe or appropriate, okay? Have you ever heard of a term called care in the air? Yeah, so what is that? Anyone? Andrea?
Hanging up, having another peri care.
Right, okay, so what do you think about that? Everyone's shaking their heads. Okay, it's unsafe, it's not dignified, it's not culturally normal for us. None of us get up in the swing and do our peri care in the morning before we come out to work, right? So for all those reasons, if you see that taking place, please make a stop to that. We can't be having care in the air. But if people are resorting to doing care in the air, then that tells me that there's something else going on, that it's hard to provide care in bed, or we don't have the right resources or equipment to do it in a different, easier or safer way, okay? So this is where trying out these different slings after I'm done talking, checking out Bobby's tilt commodes, checking out the adapted clothing and the other resources that are available here can really help us think of solutions so that we can avoid care in the air. Yeah? Make sense? Okay, so no care in the air, okay? After all, nobody in the care homes that you all represent will be doing it anymore, right? Okay, thank you. Yeah? Yeah.
My mom's in a facility, and I've seen them do care in the air. The new expression for me.
Yes.
It's usually right at toileting,
Right at,
after toileting.
okay, yes.
So what should be done? Do they bring her down, or what would you do?
Do you want to talk about that? Yeah.
So
Come on over here, Kim.
So what Jilla said, best practices, don't do it just because one, it's very unsafe. So if they were doing a pericare, sit them on the commode, get them into the toilet. Once they're done, if you needed to clean them up for pericare, if you can, put them back to the bed because that's where it's safe. There's no risk of falling. And if they are having a hard time to do the care on the bed, as what Jill said, then we have to see, like, what's the problem? Is it the repositioning? Is it the materials that you guys are using, or is it the bed itself? Like, we always have to like look into what's the problem. Because again, we always have to get into what best practice is.
Yeah. Does that make sense?
It does. But it seems that I know it's my mom I'm talking about, but her bone is deteriorated in the sense that the muscles are no longer there, and you have to basically lift the flesh to clean under. It's like, and then with a bit of dementia, there's that much more difficulty to bring her back to the bed or put her back on the commode, especially if she's combative. So all in all, just asking the question, it seems that you have people going at it, and then when you get too many people doing it or crowding the area, the individual gets that much more combative.
Yeah.
So
Yeah.
is there not a way that, and I know it appears not to be dignified,
Yeah.
but it is a private moment that maybe a level of water washing on something that can take place.
Yeah.
Rather than, doing this and doing that. Before you know it, it's like 30 minutes has gone and the individual is just really combative at this time.
A tricky situation like that really requires a team approach. So, you're talking about behavior, and you're talking about during a personal care task, and you're talking about, time, because we don't have 4 hours or, an hour to help with one person's morning routine. And you're talking about people resources within the care home, right? But really for something like that, it's really a matter of the team and you advocating for mom, right? And getting to know mom really well to understand what approaches will work better for her so that she is not demonstrating those behaviors that you're talking about, but so that we can still provide safe and dignified care. Because at the end of the day, even though it might be quicker and she's not as combative, there are still many reasons why care in the air in a situation like that are still risky for her. Yeah, so if we can find a way to reduce those risks, provide best practices so that the personal care is being done while she's in the bed and not hung up in the sling, and do it in a way that is not triggering her, and that the way that the staff can be all on board, that would be the best. And that really requires a team approach, not just from your mom and the care staff, but also from family as well. Yeah. Does anyone else have any comments on that? We have like a team of pros here.
Maybe.
Yeah, Venus, come here.
The reason why she's combative to begin with is because maybe she could not say, why are you doing the care in the air, right? Like maybe she doesn't like therapy yet.
Yeah.
Right? So
Yeah.
because maybe she could not advocate for herself. So that's why part of the reason because why in the air while they're doing
Yeah. I would suggest they give it a try in bed with some new solutions that they haven't tried in the past, and then go from there. But we can talk more about that after. Yeah, thank you. All right. Okay, so we're going to talk about tilt commodes. So we've talked about hygiene slings, and now we're going to talk about tilt commodes. So Bobby has brought a few different, sorry, Bobby has brought a few different tilt commodes here. You're more than welcome to try them out. What we find often in many different settings as well is that tilt commodes are really hard to come by. But remember, if a person requires a tilt wheelchair for their positioning and seating, then why wouldn't they also need a tilt commode when they are up on the toilet, right? So advocating for making sure that they are using the proper equipment for their personal care is really important. There are many different types of tilt commodes out there. Some of them are even height adjustable so that, from an MSIP perspective, it's even easier on the care staff who are giving showers, that kind of thing, okay? But it's really important that we keep in mind that a tilt commode, they are still options, and they are very much not just options, but necessities for some people who are up in the commode and who require specific seating and positioning. A commode is no different from a wheelchair from that perspective, okay? Now, also with commodes, don't forget that tilt commodes, or any commode, can be used in the shower or for toileting, right? So if it is at all possible for a person who can be on a toileting routine, for the commode to be wheeled on top of the toilet in the care home, that would be best practice, okay? Because again, we're looking at what is the most dignified, what is the most normal in terms of our cultural practices. Probably wheeling the commode over the toilet, not using the commode with a pan underneath at the bedside, right? So always thinking about how is it as close to what this person would normally do. Okay, so we were talking about why is care in the air so popular? Sometimes it's because it's really hard to turn people onto their side. And once we get them on their side in bed, it's really hard to keep them inside lying position, So tri-turner slings are an option, and these are meant for turning people and helping people to turn. They are not meant for transfers, so don't try to use this to transfer somebody up to a wheelchair or commode or something, okay? And these are really useful for helping people to do care while they are in bed. Can you hold it up one more time? Thanks. One thing I have noticed is that because there's this narrow part of the tri-turner sling, which is the whole point, is it gives people access to the peri area. If they are heavier people or if they are prone to skin breakdown, it can happen that they're more likely to develop a pressure injury in the area along the seam of the tri-turner sling or at the narrow point of the sling. That is common sometimes, or that can take place. Thank you. And then lastly is repositioning slings. So again, you looked at that VCH mobility decision support tool. If it tells you that for bed mobility, your individual would benefit from a repositioning sling for bed mobility, then this is the type of thing you're gonna want, okay? Again, they're not meant for lying to sitting or sitting to lying transfers. If you're gonna be transferring anybody with this, it's just with like a lateral transfer, if anything. But they're really great for boosting people up in bed, helping people to turn, and you can use them, and Kim will show you all too, how you can use them to your advantage when you're providing care in bed. Of course, repo slings are meant to be left under the person so that you can boost them or turn them anytime. So they're always gonna be made out of this, generally always gonna be made out of this really nice spacer fabric. And then lastly is just the different fabrics. Thank you. So these are the most common types of fabrics that you might see. You might see like a really tight knit nylon or polyester fabric. There's no stretch to these ones. They can be quite rough to touch, okay? I wouldn't recommend these slings for people who are prone to skin breakdown. You get your very popular mesh net polyester ones. Again, they have a looser weave, but also no stretch to it, okay? These are good they're good to be used in the shower though, but they do take some time, like a day or so to dry. And then lastly, you've got the black spacer fabric here. And when you look at it really closely, you can see that there's lots of airflow through the sling, through the fabric. And it's also got a 4-way stretch. This black material is the only type that is meant to be left underneath people, okay? So if a person is going to be sitting on a sling in bed or in their wheelchair all day long, then these are the only ones that are really meant to be done for that. Thank you. And then lastly is sling replacement. So we all know that you're supposed to check the sling before you use it every single time. But what are we really checking for? So you're obviously looking for frayed edges, holes like cigarette burns, stuff like this, and then loose stitching. And then also, sometimes you see after they've been put in the dryer, the leg straps get all puffy and puckered up because they dry weird, okay? So if you see that, the sling should no longer be used. And then lastly, if the label, like the manufacturer's label, if it's been washed and used so many times, it's completely worn and faded out, then also, according to WCB, it should no longer be used and needs to be tossed and replaced, okay? I know in a pinch, you're like, this is the only sling I have, and the manufacturer label is faded, but there's nothing else. So best practice says, if that is the case, you're not meant to use that sling, even not just this one last time, because this is all you've got. The sling needs to be replaced and not used anymore. Do you have any questions about that? I just wanted to point out, because I'm almost done, that the MSIP team has shown up. So if you have any questions about slings, Viara is right here. What's your name? Claire, nice to meet you. I didn't know who you were. I figured there was more than one of you, but I didn't know who you were. Okay. Great, awesome. So you can ask them for any, MSIP team is really a great resource for, especially for the VCH folks, if you have any questions about slings and lifts and transfers. There's our references. I wanted to say thank you, and I wanted to say thank you to all of the vendors who have shown up today. I'm gonna leave this slide up for you to walk around and just check out what's going on here. If you come to the sling station, Kim and Lana and Brian are going to be demonstrating some really creative ways on how to use different slings to perform care in bed. So for example, how you might be able to wash a person's hair in bed, how you can get into difficult areas like the axilla, or provide pericare that is a lot easier on your own backs or the people providing care. So I highly recommend that you come and check this stuff out too. Okay, any questions? No? Okay, thank you.
Oh yeah. Hi, yeah, I have the robotic feeder here. So this one helps a person who have disability or unable to feed themselves. And there's like 4 bowls in this container. I believe this one is US made robotic. And yeah, they can choose which bowl they want. Like for example, if they want broccoli on this one and then no, they can move it on the other side. If not, and then if they decided that food that they want, and then they could just say yes. And it can scoop it, and if it's like a soup, it can clear the spoon and feed a person. And this bottle, they can, if they have a disability on their upper arm or unable to touch it on their arm, they could use their shoulder, even the feet, for control. Yeah, and then they could, if they even decided not to have that one, they could just say and put it back. And this one you can configure it on any level. You could just set it on that any level, and they can carry it. They could bring it in the restaurant and all that. And this is intended for a person who have spinal cord injury, muscular, what's that, MS and all that. If they are unable to feed themselves, it's really good. Yeah, and you can try it out. And we have some pamphlet here and website that they could check on. It's the OB. Yeah, it's called meetob.com. All right. You have any question? Play around. And if you don't use it, it goes to sleep mode. Yeah. Yeah. So it saves battery. So it's rechargeable. So you could just bring it anywhere you want. Yes, yeah. So it's very easy. It only takes few seconds to do that. So basically, you just press this one each, and then press this one and configure it on your level. So like if a person is lying down in bed, like on an upright position, then you can configure that one. Also, children, they also use this one. So it's yeah, it can configure it on any level, and it comes with 2 spoons as well. So yeah, the other spoon is like a little dipper for like soup, and it's all dishwasher safe. Yes, yes, yes. And yeah, it's cool, isn't it? See? Yeah, so these plates are good for feeding. So these rims should be facing with the person and then scooping so that it won't get messy with their clothing, and then it will stop the food from coming out. So these are cool plates to use as well.
But it's OT professional practice, so it's
Jill and Melissa often go to like a meeting, I think,
on Mondays.
totally.
Yeah. So is this just like a teaching tool? Is that what this one is for?
Yes, it's a teaching tool. So we have a whole bunch of them. Do you want me to show this?
Do I have to be on the computer?
Vision impairment that represents if you I'll see what is it, what does it say? It is. So this one is retinal pigmentation. So someone who has one, can you what can you describe to me what you see?
Things are discolored, and I can only see out of the center, like right at the center of my eye.
Yes.
Everything else is more dark.
Is more dark. Yes. So so the representation of these visual glasses is to help care providers and caregivers to kind of step a day in the life of a person, and knowing that if they can't see very well, how you can approach them, or how, you know, if you're talking to someone or trying to get their attention, you may not want to come this way or that way depending on what they're seeing. And also if they get startled because they don't know that we're coming for them, then responsive behaviors might be seen and all that. Yeah, so that one's an interesting one, isn't it? Like it's cut off, and yeah. And a lot of people might oh, this is a tinnitus one. It's quite it's quite the noise. Try it out. Yes. Can you hear it? Yes. And you don't even. I think there's a little bit of tinnitus in all of us.
Yes, yeah, I think so. I think so.
Oh, that one is. That one is, yes, it's the same. Yes, and I think that one's not plugged in properly. But yes, we oh, this one here is simulate someone with reduced, yeah, and also tingling.
I'm serious, I don't know how to do it. I don't know how to do it.
Nothing. We'll start with our t-shirt and directly over the head. It's all fastened. What I love about it, there's a generous back coverage. It's not down the spine. It's a full coverage. And you wouldn't even know that it's adaptive in a sense. It opens up totally. So it's front dressing. You just put it in and someone will assist and get the back done up. Those with extreme two pieces put on. And then you can also leave the zipper closed, and again, you get your front fitting on the water they struggle. So to me, just getting your front dressing is absolutely awesome. And we carry our pants. It's a blend. I know often we have polyester or cotton, but oftentimes people are asking for comfortable. And this has spandex in it. And again, it preserves, always keeping in mind the individual's dignity, always. And we have sturdy snaps so that we can consider sizing, because sometimes the tummy is much larger. And again, the flap covers everything. So if an individual is not totally bed bound, but they're active, they're able to wear these with dignity and no one can see what's underneath. And our tops, we have many different colors, many choices. We think sophisticated, smart looking things. And some, oh,
What do you guys have for pants?
oh, right here. We have many different fabric. Uh, oh, yes. I was just showing, maybe I should have demonstrated how it would be fitted. Now, this is one of our pants. Nowadays, it's all about comfort. Speed, when I say speed, I don't mean breakneck speed, with thoughts of being careful and safe. That's what it's about. And especially people that don't want to be touched all the time. But these are our pants. As you can see, there's full coverage in the back. And they just sit and just pull it up. And if they bend over slightly, you can do up the back. And we've given different sizes on that. So, and we think about the dignity of the individual and for them to look smart and sophisticated and feel good. We also have dresses, which have a wrap dress coming out, which is also adaptive in the sense that it goes in two pieces. This is one of our basic dress. Same process. As you can see, the full coverage. Anyone can basically put it on and walk down the street. No one would question whether it's adaptive or not. Yes. So same opening process. Open from the back fully, never over the head itself. And different fabric. We make them with, well, we don't try, we do stylish and with different personality for different people. Our nightgowns we're very proud of. Same thing, nice overlap, all cotton, flannel, really soft and comfortable. And again, the more you wash it, the more comfortable it becomes. Yes. Oh, our men. We have polo shirts. Same process. Open from the back with an extra snap. Yes. And this is also a cotton. And it's all very sturdy. You know, today nothing really lasts. Everything is made to be thrown away. Fortunately or unfortunately, it's good, really good quality that we use. We think of saving our planet by not throwing away. So sometimes in the facility, you know, they keep things for quite a while sometimes. Okay. Oh, you're so welcome. So welcome. Thank you. Oh, the shoes. I'm wanting Janelle to discuss the shoes. But our propet, it's made out of the stretch fabric. But I think Janelle is more on top of the shoes than I am.
Can I give you this while you're explaining what you have here?
Oh no, I'm gonna be like in this whole YouTube channel.
Are you going to
order with you? I need to
You're not actually in it. It's just
Okay.
yeah.
Okay. Hi. Where have I seen you before?
In like so many inserts.
Okay. Great.
Yeah, because I'm another CRT too. I do the Vancouver Cultural Health.
Oh my goodness, I am so sorry.
That's okay.
Of course. Just how many faces I see.
It's all good.
So sorry.
No, really.
Yeah.
I know. So many faces. I know. I believe you.
Yeah. How are you? It's nice to
I'm
see you.
good. How are you?
I'm not sure if I should do this. I am on. Okay. I'll be right with you.
Yeah, there's some issues with data. To size up significantly.
Yeah, we find a lot of the adaptive shoes, like for example, like for folks who have ambulatory.
Yeah, that's something that most toddlers would be capable of having if you can observe them enough to recognize that they just need something, some kind of small different part, then by all means, that's it. I'm just too far away from that something like that. Slippery up front. Nothing to catch on. That's nice and stable. So adaptations. But fit is really the hardest one. And I'm working on this new technology is like really helping me out.
Can I put this on you so that folks can hear what you're talking about with this new technology?
Sure. Wow, I've never done this before. Up. Yeah. A little more. Yeah. So this is a good example of a foot that really has a challenge fitting in a standard last. Standard. This is the last, so standard lasts are typically pretty straight. The standard is to go up to through the second toe, center of the heel, second toe. All footwear is designed like that. Of course, not all feet are like that. So this heel is, heading in this direction. So you can see right away that he's going to have major compression out here on every shoe. So, so the challenge is to make a shoe for that. Logically, you just follow the foot. But this is the thing that makes that happen. And producing that has been really challenging until now. Yeah.
Otherwise, you would have been like shaking it.
A block of wood. Yeah. I don't have my my wood molds, but I have a wall of my clients. I have all wood, and then now you can see the transition from wood to plastic. So it's super. It's just the beginning. Like this is my crash course over the past 6 months. I learned this program, and I've just been totally obsessed with it. So, but it's coming closer. It's coming closer to actually make it feasible for somebody with a foot that's this shape to have a proper fitting shoe. Yeah.
Anything else you want to share about what?
Yeah, lots. A very sharp knife and a very steady hand. There's many things that can be done to existing footwear. Most often, you might be familiar with a buttress or widening the sole of a shoe to make it more stable. I do that in a way that makes it concealed, so I'm able to split the inside of the shoe as well. So for a foot like this, I might consider widening just the heel section, and for this, I might consider widening the front section. Ideally, we would go custom, but obviously, this is much quicker and easier. Yeah. So far.
I know this existed.
Yeah, it's sort of what cobblers used to do in the day. So I still consider myself a cobbler, but with a specialty, I guess you could say. Thank you.
What are they doing? Oh, trying to what's in Cool.
Hi, how are you?
So what are they trying to unbutton the gloves?
We're trying to button the clothes.
Trying to button the gloves. So these are our people on a daily basis that they can't do. And some of them will have tremors also, right? You won't see it. It's He's giving up. Did he give up? Did you give up? How many did you give? So Adam, when we have people, if we're trying to have people do something that they can't, or that they're having real, difficulty with, and then it's frustrating.
Oh yeah.
Yeah. And we might see some responsive behaviors or
Successful. Very successful.
successful. And look,
Very
when
good.
it's
Sense of
successful,
accomplishment.
look how happy she is.
I was. Thank you.
Thank you so much for coming.
For like one-offs for patrons. Fun little thing. We're all from Canada. Yeah, and we typically compare people in BC with requesters in BC. Yeah, so that's kind of what it is. So you like if you wanted to become a contributing member, there's like a page called Makers Wanted, and you can filter into BC requests and stuff that's like doable for him. And yeah, he can start kind of creating devices. Nice, that's awesome.
I'm gonna try this out.
Okay, yeah, take it with you.
Yeah, I have a couple cards and now I have like people I need to distribute them to.
Take as many as you need. I brought a stack. I'm all insured.
Perfect.
Can I give this to you and explain? Can you tell me what you have here?
Yeah, absolutely.
If you can pin this to
Okay, perfect. My name's Reed. I'm with Makers Making Change. And what we do is we have an open source library of assistive devices that we provide for no to low cost. We have a variety of devices here. A couple like writing aids. So this is a pen cuff. Again, arthritis or low grip. It allows somebody to write a lot easier. The pen ball is a similar concept. Gives a larger grip surface and more control. What else do we have? Printing right now, currently, a lot of the stuff that we have is 3D printed. This is a toothpaste tube opener. So it's got the grip channel there that allows somebody with low grip to twist the cap off. And then it also has a function that allows you to kind of slide whatever liquid or paste is in there up, whether hand cream, toothpaste, whatever it is. Our products are available on makersmakingchange.com, so you can make a request there, and we partner with a bunch of makers in the community to service those requests, and you only pay for the cost of like the filament or the equipment that goes into it. So these things, something like this, is very, very low price. $3 to $5, if that. Usually the volunteers don't push too hard on that. So yeah, that is. So this is a smartphone magnifier. My phone is out of batteries, but you can set it up to kind of have a zoom, and then if you had pieces of paper or newspaper, you can move this back and forth and read the text on the screen. That's kind of like an easy magnifier.
Awesome. Thank you so much.
Any questions? Yeah.
No, good. Any questions for you? No. What's this one?
This is a bottle opener.
Okay.
So for bigger bottles like I don't know, like vinegar, or olive oil, things like that, cooking or like refreshments. You can slot that in there, and then this is flexible, so it allows you to kind of grip on there, and then just gives you a lot more leverage to open up that. Is there a bag carrier? So when you're carrying groceries home, this is something that I feel like is useful to everyone in this building. So yeah, this helps kind of carry the.
Are you giving those away?
Yeah, if you would like one, please take one. Come back here once you're done with your.
Cool.
Yeah, anything that you're. Oh, and that's a serving spoon. So that's a left-handed one. So you put a utensil in there. It comes with a strap. Usually, I didn't bring the strap with me. I'm sorry, but it just gives a bigger grip surface for somebody, and kind of along the very similar design concept. Larger grip surface and a little bit more.
Thank you.
Yeah, absolutely. And we have different types of toys, some plushies, like, that you squeeze. And what we do is we switch it different. So a lot of those toys have like.
Do y'all want to talk about this? Can I give you this and just pin it on you so you can talk about it?
Okay, actually, he's the expert on this. Do you want to explain? Yeah, the Indian.
I brought this just to show people. Just so it's a good thing.
I want to see it. Let's see it.
So this is a lift. How's it? How closer? Sorry.
It's so nice.
7,000.
Yeah.
So we have to switch.
Just add it to the bill, So this is a device that is not available in Canada right now. It is a product that I've been working with the manufacturers just to see if it's a product that would be a good fit for us. We first came across this product through a resource therapist in Fraser Health. They were doing a fall prevention symposium. And then Wendy calls me and she's like, hey, have you heard of this product before? And so I was like, no, absolutely not. Did some research, and I see that it's a product that products for people that once falls risk is identified. We have the Steady for people that need a little bit of help, all the way up to your ceiling lifts. But the people that are still mobile but are unsteady on their feet and living at home have been a gap that I've been trying to fill for a couple of years now. And so when I saw this product, I was like, light bulb moment, let's chat with them and see. So it's not a very complicated product. It is a product that goes all the way down and lifts all the way up to, in this case, the standing height. This one has a 400-pound weight capacity, and you can roll it around to wherever the person needs. So in the private setting, if you put it in like a living room or a place where there's a high risk of falls, if the person does fall in their home, as long as they're able to move themselves onto this platform, they're able to get themselves back up into a seated position or a standing position. Another place that I think would be a good fit for this would be for like retirement homes, assisted living sites, places that they don't use a lot of lifting slings very often. Let me know. What do you guys think?
My job is always staff safety.
Yeah.
So I'm looking at is this safe for staff to use? We always the ceiling lifts. Ceiling lifts the tracks aren't everywhere, right?
Yeah.
So sorry.
No worries.
So then floor lifts are what is currently the standard that we use. So I'm just I don't know about this product. I don't know enough about it, and whether it's if somebody's fallen, you have to think about can they get on, can they get off? What's their transfer? Obviously you'd be hey, are they medically stable enough to use something like this before you consider that?
Yeah.
I feel typically what happens is somebody would get assessed lying on the ground where they are, and if it's appropriate, they use the lift and then kind of bring them
Absolutely.
to bed.
Yeah.
I can see it being useful for like people who just can't get up off the ground, but otherwise are independently reliable.
Absolutely.
Right?
Like over the last
As long as you can get to it.
Yes,
yeah.
exactly.
Like over the last month, when I've been kind of like weaving into my conversations for home visits specifically, and you hear stories about how people fall 3-4 times a day, and then they have to go and find their favorite chair to climb up on, and so this is a product for them, right? Like there's a
Smaller footprint.
yeah. There's another client where they told me a horror story about how they're out gardening and then they fell in the lawn, and there was no one to help them for like a couple hours, and so in this case, if there was someone home and they were able to wheel this to them, they'd be at least be able to get up.
Did you mention that you saw this in care homes in like emergency fire hallways or something like this?
So in the U.S., this is a very popular product. All the VA living sites have it. All their fire departments, or a lot of the fire departments, will have this as well, just to help with transfers. And then there's
They like bring this in the car and then into somebody's house.
yeah, it's 60 pounds total weight.
They do a lot more lifting than we
In the U.S.
Well, no, just fire.
Oh, fire department. Yeah.
Right? Like
Yeah.
they'll lift people in and out of their house. Sure.
Yeah.
Staff here will. They are the people who are always called to those.
I can see that type of call where this can be really great.
I was thinking was I was thinking about calling these fire departments and be like, which sites do you get the most calls from? And then go and be like, hey, guess what I have? A product for you. Yeah, I mean, this is obviously not a product for everybody. For me specifically, my vision is that if it's a need that is largely untapped right now, and so it's a cool little product.
I like the fire department replacement situation because it saves their resources.
Do you know how much they're charging?
Oh yeah.
They're charging like $150 each lift.
For each pickup, really?
Yeah. Yeah.
But that
So.
would still be charged with this. It was just they would have a different way of getting something off the ground.
If the fire departments were to use this, yeah.
So you're thinking of if this was left in somebody's house.
Yep. And they use this instead of calling fire department each time.
I only struggle from not MSIP but clinical perspective for clients in their home. It's well, obviously funding. This would likely be private purchase. Then I'm what's how long are they going to be using something like this?
Yeah.
I guess it could be there for emergencies, but the person who's falling from the ceiling.
This is going to be a product.
Try not to drop it. There we go. Okay, so here we have a bunch of different slings. Each of them is best for different type of population as well as different circumstances throughout the day. So the first sling that we have here, I'll just give you a view. It's a hygiene sling. So this is globally, and it's called the content. Basically, how this goes on is these go on like backpack straps, and then this strap comes in and cinches the waist. So this is really good for people who maybe don't sit up straight completely when they are on the edge of the bed. So then when you start lifting them, the sling comes loose. So this is really good because it'll actually cinch at the waist and be able to kind of change as they are lifted with them. So these straps would hook onto the lift itself, as well as the backpack straps. And then you have the leg straps that can go underneath each leg, and then you have the back left open for any kind of care that you need. So this is, again, really good for people who need a little bit more support on their back, on their head, compared to a traditional hygiene sling. Over here, we've got our deluxe recline sling. So this is not to be used for any sort of toileting because there is no hole in the back, as you can see. And this also comes with head support. This is a very supportive sling. And it's really nice for people who have like wide hip angles because of the way that it actually attaches. So it is able to accommodate that. You have these straps. This is also can be good for people who are amputees. Maybe they don't fit some other slings. You need this central piece to help make sure that they don't fall out of the sling. That can be a really helpful piece as well. And then, as they were talking about earlier, this is also really good for people who need a more open hip angle. So this is great for any sort of lifting, transferring, anything like that, as long as you don't need to perform any sort of hygiene care. Here we go. Here's our tri-turner sling. So this is actually made to go right under the low back area. You attach one end to the side of the bed, and then you're able to use an overhead lift and actually turn. Sure.
And you need to move your leg to the other side.
Sorry. Does that work? Okay. So, let's see. If you want, we can. So, we're able to attach this to the rail so that it doesn't move. And then you want to make sure that the base of this is just under that low back area. And we'll take our lift here. So we can just attach one of these on each end. And then use the lift to do the actual turn. So you might have to lift one leg up exactly so that as she turns, she's in the proper position. And then this leaves a little bit more room for any kind of hygienic care as well. Just like that. And this can go on both sides, so we can just switch the lift to the other side to be able to turn the other way as well. There we go. Thank you.
Anybody else want to get in?
Yeah, we've got a couple more slings if you guys. It's a good question. I know this company only does this material, so yeah. So yeah, the repositioning sling can actually be left under a patient, whereas the tri-turner cannot because of the material of the sling. So this one is meant to stay on the bed and stay under the patient for as long as you need, basically. And the repositioning sling will also attach to the bed itself so that you can do essentially the same thing. You just don't have as much of an opening for care. Yeah. So if you really wanted, though, you could kind of fold it and then.
Which one are you trying again?
What are we demoing now?
Okay, so we've got these.
Do I lie down? Do I need to take my shoes off?
No, go ahead. Go ahead and lie down. You're good. So we've got these straps that can go around a mattress, and that'll allow you to actually keep the sling on one of the sides. Ideally, you'd do that before she lays down, but we're improvising here. So then what you could do is so I'm just going to kind of go down the line. It depends on what exactly you're using this for. If you're using it to like just turn you, then you would obviously only need one side. We've got that side attached. That's kind of what I've set up for. But yeah, we're just gonna take these different straps, and depending on your center of gravity, you can change the amount of straps that you're hooking up. So like, I'm not gonna hook up the ones closer to your feet, but I can get this one. So same thing as the tri-turner. I'm gonna have you lift this right leg or bend it so that when it starts to go, you are good. So at this point, we've got her fully on her side. This is great for when you need to turn someone and just get that pressure off. It's a little bit more difficult for any type of hygiene care compared to the tri-turner sling. But if the tri-turner sling is not an option, there are ways that you can do this depending on their center of gravity to still be able to provide any kind of hygiene care like that. How you feeling? Okay.
Hey, Christina, can you stay there for a minute more? Yes. I wanted Kim to demonstrate how you can wash somebody's hair in bed while using a Rico sling as well.
Go ahead.
Would you like to take over? Okay.
All right. So
Oh wait, hold up.
I'm not ready for this. See, I told you I'm not ready for this. Good. So in addition to what was shown earlier, I depends on the person. Right now, she's okay. She's well fitted on the bed, so you don't really need to maneuver too much. But like with a two-person, we can kind of like with the lift, we can offload her a bit, pull her a bit to my side before turning. That gives enough clearance so that the person will not hit their face by the railing. And like we can put like a pillow or like a bolster or something by the back to kind of like support the person. And you can do the peri-care with a wad point turn maneuver, meaning like I'm just gonna do it like this. Okay. Don't do what I do. I work out. All right. So all right. So I'm just gonna pretend there's a pillow behind you. Is it okay if I touch your legs? Yeah. All right. So I'm just gonna reposition it so that the hips. So usually the body will follow the hips, right? Then imagine there's a pillow here that stops her from turning. I can let go some of the slack or create some slack. Open this up. And I have enough clearance that I can like wash the back. I can do some peri-care, and or if your nurse need to do some wound dressing as well or anything
in between, this is kind of like a good tool to use it safely without really like hurting your back. Again, it's kind of like minimizing your doing any manual maneuvers. So when it comes to doing hair wash or whatnot, I find that this is a good tool too to use as an assistance. It can be done ideally with two-person. Anything maneuver with a sling. Best practice, do it with two-person. It can be done with one person, but that's a case-to-case basis. All right. So I'm gonna get you to lay down on your back for me, if you can. Thank you for your participation. All right.
Christina.
Hi, Christina. So ideally, when we're sizing the sling, we always have to make sure that is it the proper weight for the person, or is the person, it's like the weight plus like the height. That's what we look for sling, right? It also goes for reposition as well. And we have to position that it's actually quite close by the head. Oh yeah, it doesn't move. Never mind then.
But that doesn't move.
I'm so used to like it going. Yeah. All good. All good. All good. Can I get you to hang the other side on the blue strap, please? There you go. Blue, please. Oh, it was. Okay, thank you so much. All right. So this is a good tool for doing hair wash or anything for the head. That's fine. All good. One's good. There you go. Yeah. So that's why I say it's a two-person maneuver, because one would be holding the head or at least the neck. If you don't have anybody, if you have like a pillow that you can put underneath, you can use the pillow and you can put some soaker pad. Then you can do your hair wash. You can use a basin, you can use the hair cap or like a ladle or something like for doing this. If your I'm gonna put you down. If your bed is something that you can move as well, you can move the bed, get a better clearance, take off the headrest, then you can somewhat dangle the head. That's another option too. I find it okay and it's also quite safe because I do it a lot with people who has a trach and vent because we don't want any fluid going inside their stoma, right? So yeah, thank you so much. That's my.
Throw these in the wash?
Yes, you can. All no. Also, my pet peeve when it comes to this sling is don't put too much layer because it kind of like defeats the purpose of like being breathable and being soft. So as little layer as you can. There you go. Thank you so much. This is fun.
Can you demonstrate using universal sling to hold hands?
Universal sling, hold pants in bed. Just with the universal.
Do you have any tips on how to pull up hands for people who have really heavy legs and hips?
With a adaptive or non-adaptive clothing. Non-adaptive clothing. That would be quite tricky. Ideally, if it's quite hard for the person to be doing it, they should be offered adaptive anyway. That's kind of like the policy for BCH anyway when it comes to admission. Doesn't mean that it's impossible, it's improbable, but it's not impossible. For those, I know. For those instances, again, it has to be a group effort. It has to be at least a two-person. A lot of like turning is gonna happen. You can probably do it by yourself utilizing the reposition sling. So get them, you can do a 1 to 2 point turn while holding the person. You can pull one side, do another side, pull one side slowly. It's time consuming, but that's your safest bet without hurting the person and without hurting yourself. So for me, that's kind of like what your go-to is. Once you know the person, once you know the proper maneuvers, usually it would only take me about 5 minutes tops. I've done it before, and 5 minutes like the most that it would take me. So yeah, you're welcome.
We're still streaming, right? What do you do? What's this one? Yeah, to show it, like somebody actually said, yeah, okay. Can I get you to put this on again? Just kind of right over here. Can I do it for you? Go ahead. Sorry.
Okay. So you want to just sit on the side of the bed? Yeah. Okay. So this is the easy access continental sling again. All right, I'm just gonna reach behind you if that's okay. So you get to put your arms through there, yep. There we go. Is it okay if I touch your sides? Yeah. There we go. Stick the straps over here. So first thing that we're gonna do is we're gonna cross the straps. So this one goes through this loop here. Pull that through. Same thing on the other side. This goes through this loop, just like that. So ideally, we want this kind of, yeah, right hugging your midsection like that. That's where that goes. And then I'm going to lift up your left leg first. And we're going to stick this under there, just like that. Same thing on the other side. So we're going to pull this through. And then I'm going to cross these two straps. So that'll just help keep the legs together a bit more. And then we've got our lift here. So I'm actually gonna have you kind of scoot back. Yep, that's fine. You can actually drop down that rail for now. Yeah, there we go. And bring that in front. So I'm gonna bring this down. I'm gonna avoid your face. So the first thing to know about this sling is that those white straps, both of them are going to go onto the lift. So we will attach these onto the carry bar. There we go. Just like that. And then the next step is to put these midsection straps on. So I'll just attach this to the end here. And same thing on the other side. And then finally, we'll do the bottom straps. So this is just like any other sling. I'm just putting it on the longest loop for now. I don't know what your ideal situation is, so that would be determined by the rehab staff. So we're just gonna go really slowly. Yep, you're just gonna watch your face here. And so you'll notice as it starts lifting you up, it'll get tighter and tighter around that midsection. Yep, there we go. So we just want to check the leg straps before she's actually airborne, and there she is. So at this point, you can then transfer her to a commode or wherever you are planning on doing your care. You've got the backside open, just like any normal hygiene sling. You just have a little bit more support on the back and midsection area. So I'll go ahead and let you down now. How you feeling? Yeah. Yeah, so that's one of those things that can be like changed, basically, is, hello. So that's the stays. I'm just gonna manually do this here.
I was like, are we stuck?
No. No. But I will move this from your face. There we go. So yeah, that is the big orange sling. All right, you're free to go. Yeah, the other thing is that it does have straps on the back if you need to reposition someone. So you do have those handholds going on there.
So is this like if someone needs more trunk support, they would do this?
Yeah, you still want them to have some trunk support, but if they, it's honestly really good for people who just don't like having their back completely open. Like that makes them feel uneasy. Also, like I was saying earlier, for people who want that cinch to continue as they're being lifted. All right, absolutely.
Switch it to the other screen if you can.
everyone. My name is Bobby. I'm from National Seating and Mobility, and I'm here to talk about tilt commodes today. Many of you may have seen this. This is the Aquatech VIP tilt commode from Invacare. This has been around for a very, very long time. Some common features with shower commodes is that they have 4 locking rotational casters. Everything from the base up is height adjustable to a certain extent. This one in particular has 4 inches of seat height adjustment. This shower commode has 40 degrees of tilt. I'm going to keep it in tilt to show you guys. We have removable footrests, removable swing away footrests. You have many options for your foot plates in terms of just the standard ones, angle adjustable ones. We have all types of strapping systems for your commode as well. Taking a look at the base here, we have gas struts here. This is a stainless steel frame. Comes standard, we have a basic plastic seat here, 18 wide with a good opening. If you needed something softer for your clients, you can definitely add on this soft seat. And it's more of a comfort layer for those clients who are sitting in using the shower commode for longer periods of time. Armrests, lots of accessories. You can get laterals, you can get thigh guides as well. Tension adjustable back comes standard. You can get different backs as well. All sorts of types of headrests as well. Lots of user-friendly knobs so that you don't have to use tools to adjust. And that is the Invacare commode. We'll move on to the next one. And this is actually one of the latest commodes from a company called Raz. This is called the Raz Art, A-R-T, and that is stands for Attendant Rotational Tilt. What's really special about this one is that they actually have gotten rid of the gas struts for this model, and they have come up with this arc system. One arc on this side and one on the other side. You might be able to see the teeth of the arc here. What's really special about this is that it is meant for all sorts of attendants. I am 5'4", on the small side, and I can tilt this with ease. I can tilt it with one hand, and when you have a client in, you're going to be able to tilt with ease. So this is mainly, this is a great option for your smaller attendants. I love Raz. They have every option available. If you have clients with skin integrity, this is the one to go to because they have more specialized seats. This is a nice thick foam. It has dual layers of foam inside for skin protection, for immersion purposes. You can get different types of cutouts, different types of holes. You have a flip back armrest, tension adjustable back, but also many options for backrest. You can also get a solid backrest. This one is pretty cool. If you have somebody that has a larger hip area trying to get into the commode, you can pull these armrests, swing them out, pull and swing out so that you have full access to get the client here. And then when they're in and stationed and ready to go, you can flip that back. Again, the biggest thing with this is the ease of the tilt. All similar accessories, just like the Invacare Aquatech. Laterals, thigh guides, seat belts, chest belts, different types of headrests. Everything is an option for Raz ARTs. Thank you very much.
Okay, so again, I'm not sure if you're not familiar with the maneuver.